Eileen Bayer, the theme here. Welcome to episode 4 on Huntington's disorder and our little mini mental health series. And in this episode, we are going to be covering the complications, prevention, and diagnosis of the disease. So let's get started. After the start of Huntington's disease, a person's functional abilities gradually worsen over time. The rate of disease progression and duration varies. The time from disease emergence to death is often 10 to 30 years. Juvenile Huntington's disease usually results in death within 10 years after developing the symptoms. The clinical depression associated with Huntington's disease may increase the risk of suicide. Some research suggests that the greater risk of suicide occurs before a diagnosis is made and in the middle stages of the disease when a person has begun to lose their independence. Eventually, a person with Huntington's disease requires help with all activities of daily living and care. Late in the disease, he or she will likely be confined to a bed and unable to speak. However, he or she is generally able to understand language and has awareness of family and friends. Excuse me. The common causes of death include pneumonia or other infections, injuries related to falls, complications related to the inability to swallow. Now, there is some prevention for Huntington's disease, and we're going to be covering that. And as I said, also the diagnosis of it. Okay. The prevention is in vitro fertilization. People with a known family history of Huntington's disease are understandably concerned about whether they may pass the Huntington's genes on to their children. These people may consider genetic testing and family planning options. If an at-risk parent is considering genetic testing, it can be helpful to meet the genetic counselor. A genetic counselor will discuss the potential risk of a positive test result, which would indicate the parent will develop the disease. Also, couples will need to make additional choices about whether they have children or to consider alternatives such as parental testing for the gene or in vitro fertilization with donor sperm or eggs. Another option for couples is in vitro fertilization and pre-implantation genetic diagnosis. In this process, eggs are removed from the ovaries and fertilized with the father's sperm in a laboratory. The embryos are tested for presence of the Huntington's gene, and only those testing negative for the Huntington genes are implanted in the mother's uterus. So that's the only way you can stop it because it is genetic. So there's a lot involved with it. Basically, if you know you have it, of course you don't want to pass it down to your children. So those are some options that people have that have it so that they don't pass it down. Or, the other option is not to have children. So now we're going to cover how they diagnose Huntington's disorder. A preliminary diagnosis of Huntington's disease is based primarily on your answers to questions: a general physical exam, a review of your family medical history, and neurological and psychiatric examinations. The neurological examination consists of a couple of things that we're going to go over. The neurologist will ask you questions and conduct relatively simple tests in the office to judge. Um, they'll cover your motor symptoms, such as your reflexes, your muscle strength, muscle tone, coordination, and balance. And your sensory symptoms, sense of touch, vision, and eye movement and hearing. And they'll also test for psychiatric symptoms on your mental status and your mood. Your neuropsychological testing will cover things like your memory, reasoning, mental ability, language function, and spatial reasoning. Now, on your psychiatric evaluation, you'll likely be referred to a psychiatrist for an examination to judge a number of factors that can contribute to your diagnosis, including your emotional state, patterns of behaviors, quality of judgment, coping skills, signs of disordered thinking, evidence of substance abuse. So the psychiatric evaluation will go in deep into all of these. Excuse me. Hold up. Excuse me for a moment while I get a drink. Thank you. They'll also cover brain imaging and function. Your doctor may order brain imaging tests for assessing the structure or function of the brain. The imaging technologies may include magnetic resonance imaging, better known as MRIs, or computerized tomography, better known as CT scans, that provide detailed images of the brain. These images may reveal structural changes at particular sites in the brain affected by Huntington's disease. Although these changes may not be apparent early in the course of the disease, these tests can also be used to rule out other conditions that may be causing symptoms. The other thing they'll go over is, as I stated earlier, genetic counseling and testing. If symptoms strongly suggest a diagnosis of Huntington's disease, your doctor may recommend a genetic test for the defective gene. This test can confirm the diagnosis, and it may be valuable if there's no known history of Huntington's disease, or if no other family member's diagnosis was confirmed with the genetic test. But the test won't provide information that will help determine a treatment plan. Before undergoing such a test, the genetic counselor will explain the benefits and the drawbacks of learning the test results. Now, the genetic counselor can also answer questions you may have about the inheritance pattern of Huntington's disease. There's also another test that they'll do called the Predictive genetic test. Now, this test, a genetic test can be given to someone who has a family history of the disease but shows no signs or symptoms. This is called predictive testing. The test result has no treatment benefit, and it doesn't indicate when disease onset will begin or what symptoms are likely to appear first. Some people may elect to do the test because they find it more stressful not knowing. Others may want to take the test before they make decisions about having children. Risk may include problems with insurability of future employment and the stress of facing a fatal disease. In principle, federal laws exist that make it illegal to use genetic testing information to discriminate against people with genetic diseases. These tests are only performed after consulting with the genetic counselor. So that all that information on it. Friday we'll probably be going over the treatment of it and any other information. And depending on how long that is will depend if there is one more episode after that. But I hope that you're learning a lot from these series, and it is helping you to learn to see with your heart and not your eyes. Because when you see with your eyes, you're missing what counts. Because what is important is what the eyes can't see, which is in here, in the heart, inside. That's what truly makes up a person. The outside is just a shell. And if you judge by that shell, you could be judging wrongly. And as I had stated in other videos, if you research, how do I put this? If you research what bullying can do, or even just one wrong person, okay, just like Huntington's disease, they get depression from this. Now, if you meet somebody and you don't know what they have, and you're not informed, and you start criticizing them, or talking down to them, with their depression, you could cause their death. You could be the one that triggers that suicide. It's always best not to talk down about somebody, criticize, or say anything harmful like that, because we don't know what their life is like. We don't know if they have a mental illness. We don't know what they've been through in their life. I mean, I could do a biography on myself to give you so many examples of different things. But that's not what I'm here for. I'm here to try to teach you by educating you how to see with your heart and not your eyes. Because if we can all learn to see with our heart and not our eyes, this world will truly be a greater place. Because you learn to love more. And love is the greatest gift you can give anybody. I mean, love is more valuable than any gem there is. So remember, you matter to me. You're important, and you, yes, you, I see you out there, you are uniquely made. And no matter what anybody says, remember that. You were made for a purpose. Whether you have a physical handicap, or a mental handicap, or no handicap at all, we were all meant to be here for a reason. And we were created to be people that need to talk to other people. So always remember, uplift, encourage, and inspire instead of tearing down. Because when you tear down somebody, it hurts them. And when you uplift them, you release endorphins inside of you and inside of them. And your uplifting, encouraging, or inspiring word just might be what they needed, so they don't take their own life. So remember, until I see you again, I love you. Take care. Bye.